Hello, and welcome to Joint Ventures. In this OSC original podcast, we look at recent medical news from an orthopedic and pain management perspective to help you understand and apply it to your health. I'm Dr. Andrew Martin, and I'm a pain psychologist at Orthopedic and Spine Center in Newport News, Virginia. Today I want to tell you about a recent study about lower back pain. In this study, a cognitive therapy was found more helpful for reducing chronic lower back pain than treatment as usual. That's not really news. We see a lot of articles like that, especially for cognitive behavioral therapy treatments for chronic back pain and other forms of pain. What's unique about this one is the length of the study. So these results were looked at right at the point of intervention and then 3 years later. And even 3 years later, this cognitive functional therapy had better results for function and pain intensity than treatment as usual. The study just came out a couple weeks ago, and it's called the Cognitive Functional Therapy with or without movement sensor biofeedback versus usual care for chronic disabling low back pain, a 3-year follow-up of a randomized controlled trial. That's a big title. So I'm going to break it down for you a little bit and then give you some examples of that type of therapy that's used here in pain management. So this was a randomized controlled study from Australia. This was done in the Australian medical system, specifically in their physical therapy clinics. So the study pitted treatment as usual, which means go to your primary care doctor and say, hey, my back hurts, and then do whatever they tell you and whatever any specialist that they send you to tells you, versus something called cognitive functional therapy. Cognitive functional therapy is a 7-visit individualized treatment that's focused on the causes of lower back pain, the things that cause it and the things that keep it in place. And the authors of the study think that their treatment was more successful because that treatment goes after the causes. Oftentimes in primary care, there's barely enough time to treat the symptoms. They don't have time to look at things like the physical barriers to helping yourself change behaviors. Or they don't look at the psychosocial barriers, like how the normal brain thinks about pain and how that might be interfering with your getting better or feeling better. So the cognitive functional therapy looks at psychosocial barriers, physical barriers, and stress management skills. Those skills include how we think about pain, if we're afraid of pain and therefore afraid of movement, avoiding activities, increasing physical activity, healthy sleep habits, and improved social engagement, all things that are correlated with improved back pain. So I'll jump into one of those in detail here. Let's talk about pain-related cognitions or thoughts. So the normal human brain only has one way of thinking about pain, and that is damage and harm. And if my arm's broken and I move and there's pain, I am causing more damage and harm. That's acute pain, right? But then there's chronic pain. This is the pain where the doctor's telling you, hey, you might have to live with this for the rest of your life. And they're saying, you should move even though this hurts when you do it. When I feel pain from the chronic pain, I'm not doing any harm or damage. All the damage has been done. Probably all the healing that's going to happen has taken place. So I can move without worrying about harm and damage. That's really important because if I'm thinking harm and damage every time there's pain, that's going to set off anxiety, put my nervous system in a state called fight or flight, which I know a lot of you have heard of. And when a nervous system is in fight or flight mode, it is really efficient at sending around pain signals. So just my belief that this pain represents damage and harm is going to increase the amount of pain that I feel. The other drawback is I'm not going to move. I'm not going to move if it's going to damage or hurt me. Well, that will lead to deconditioning, and if I get deconditioned, there will be more pain. So that's one example of how a therapy like this really gets into the weeds and helps the person figure out what they can do to help their pain. And indeed, that's one of the reasons that we think these treatments work so well, is because you improve pain self-efficacy, or the belief that I can do something to help myself with my pain. Instead of being totally dependent on doctors, medication, surgery, whatever, there's things that I can do. That seems to be a turning point for my patients. When they really start to feel like they can do something to help with themselves with their pain starts to go down. We also think it works because we're reducing that pain-related fear. If you're not afraid of moving, you can move a lot more and keep the body conditioned, build stamina, and you eliminate that anxiety that can create more pain all on its own. Also, having less protective movement behaviors. You may have heard a doctor tell you one time, okay, here's how you walk with that cane. Make sure you don't overcorrect with this other leg or you're going to create problems in that other leg. That's another thing that's necessary to help with lower back pain particularly. Okay, so that's the study in a nutshell. It's so important. Millions of people suffer from lower back pain, and it has a big personal effect and societal effect. Personally, because I can't do the things that I want to do. It hurts my social interactions. Societally, because a lot of people can't work or they have reduced work efficiency. So it's a great topic. I'm so happy to see another study showing that there's something that works a little better than treatment as usual, and that it's still working at 3 years. Now, if you're interested in trying something like a cognitive or cognitive behavioral therapy to help with chronic pain, you'll want to look for a health psychologist. They all know how to do these. Or you want to look for a psychologist or a behavioral health provider who says that they treat chronic pain. And they treat it with something like a cognitive therapy for chronic pain, a protocol with some homework that you do in between sessions. Thank you so much for joining us today. Please like, subscribe, and share with a friend. Wishing you good health. See you soon.
At Orthopedic and Spine Center, we're dedicated to providing the highest quality treatment using the most advanced technology available. Our fellowship-trained spine and interventional pain management physicians specialize in diagnosing painful conditions and offer minimally invasive interventions to complex spine surgeries. Our pain psychologist helps patients understand and reduce stress from chronic pain conditions. Our experienced physicians get you back to doing what you love. Call today for an appointment. Experience excellence at Orthopedic and Spine Center.